Over the last 10 years, substance abuse has become a bigger problem here in the Northeast Kingdom. Being the healthcare provider for the community, I think, requires us to have some action in response to this crisis in terms of opiate use and abuse in our community.
I think the opioid epidemic has really hit us hard simply because we've had the ongoing problem with narcotics. When people convert to heroin, it's becoming a worse and worse issue. The hospital is working more with mental health and the drug rehab programs to help see what access we have for people in our community.
Over the last year or so, we've been doing a lot more to try to move in the direction of primary care access for substance abuse. We've been working with groups in the community to move that forward clinically, as well as working internally to look to provide medical assisted therapy for substance abuse.
Throughout the emergency room and throughout the hospitals, we've limited the amount of narcotics that we prescribe, and many studies have been done over the past 2 to 3 years that say we don't need to prescribe as much as what we're giving. Now we don't write for as many pills. And many people, when we explain to them the risks that go along with narcotics and prolonged use of them, a lot of people are refusing to actually take the narcotics in the first place. But we try to explain to them that we want to control their pain so they can be functional.
And part of that has been education for us as well as for our patients about what is acute pain, what is chronic pain, and what's the latest information about what works and doesn't work. As well as what's the downside and upside to these medications. That has really allowed a space for conversation and communication around pain and around opiate pills. And many of our patients have responded by saying, I don't want to take this anymore, let's work on trying to taper, or I don't want to start that because it's got these risks associated with it. Patients are much more open to alternative ways to try to help manage with pain, alternative medications to their opiate, as well as not starting an opiate for acute pain as well.
We've worked closely with North Country Hospital, we've worked closely with the emergency department. We've received a grant from an anonymous donor through the hospital to grow our recovery coaching. It's a community. Everyone needs to be involved and anyone can walk in. You do not need an appointment, and I think that that's what is so good about the recovery centers. You can speak with someone the minute you come in here. The people here want help and they become like a family, actually.
I was brought over here to Journey to Recovery, and it was like family. I walked in very nervous, and by the time I left, I was like, wow, this is the place for me.
There was no judgment. There was just, they're here to help me, and it was just a very reassuring and comforting feeling to know that there was a support group here that could help me get through this.
This is good. This is what I needed. I have people now I can contact, and if I wouldn't have come here, I would have been back using. There's very little doubt in my mind. And never in my life have I been wanting to look ahead so much. I have the backing and the help from Journey to Recovery and all the staff members.
We look at it as those people on the outside, not affiliated with us, but it's hitting everyone, and it's hitting very close to home, no matter who you are. We can make this a group effort to try and prevent addiction.